Recording.
Great. Hi, everybody. That's everybody with us here in this workshop here today, and also checking this out, watching this recorded on video later on. My name is Ben Correa. I'm one of the project officers here at CERSH, the Centre for Excellence in Rural Sexual Health, together with Mika, who's also on the call. We've been working on this project. So today is just a short workshop, webinar, crash course in some of the ways we think this new exciting resource could be used. The resource is talking to CALD young people about sexual health comics, or you might want to call it Rural River comics, or just CALD comics. We're not too worried. It's really at the pilot stage. First, before I say anything else, I'd like to offer an acknowledgement of country, if I can have my slides work. I'd like to acknowledge the Pangarang people, who are the traditional custodians of the lands that I'm calling in from today in Wangaratta. I'd like to pay respects to elders past, present, and future. And of course, extend that respect to any Aboriginal colleagues who may be with us today or watching this video down the track. We'd also like to sort of acknowledge that what we're here talking about and working on is sexual health. And we know that Aboriginal people sometimes do experience worse health outcomes or less ideal health outcomes across many domains than the rest of the population. So I suppose I'd like to sort of extend that respect to any Aboriginal or Torres Strait Islander people who are the intended beneficiaries of the work that we're talking about here today. Just another little bit of sort of housekeeping. We do want to offer a quick copyright warning. The material that's been produced is on behalf of the University of Melbourne, and you could be breaking the law if you copy it. But just reach out to us if you want to use any of this stuff, and I'm sure we'll be able to make that work for you. Really quickly, before I get into talking about the project, for anybody who's not familiar, again, not knowing where this video might land, and also for folks with us, the Centre for Excellence in Rural Sexual Health, CERSH, in case you're not familiar, we are funded by, we work out of University of Melbourne across Loddon, Mallee and Hume regions, funded by Victorian Department of Health. Our priorities are developing the capacity of the workforce. That's, the community sector, the education sector and the clinical sector. Developing the capacity to support people around sexual health, providing leadership, some research, some evaluation, collaboration, knowledge sharing, and working towards one of our sort of key priorities is creating affordable reproductive health options as well. We try to reduce the incidence and prevalence of STIs and BBVs, increase early detection of STIs and BBVs, increase best practice sexual reproductive health services, and increase access to affordable contraception and pregnancy services. Bear with me, excuse me. I'll also just add, I'm going to backtrack a little bit to our intro slide here. As I say, my name is Ben, and Mika, my colleague, is here with me, going to be co-presenting. Before we go any further, there's some folks I want to give some quick credit to in terms of this project. Ani O'Leary, Dave Evans, and Colin Stokes in no particular order. Dave Evans is a former colleague who had the original idea to sort of pursue this comic project rather. He had seen the idea delivered overseas and thought that's a really great idea, the idea of comics without any text in it, with empty speech bubbles and basic visual stories to communicate sexual health promotion messages. He thought that's a great idea, and that might actually be quite applicable to culturally, linguistically diverse young people in regional Victoria, specifically Shepparton, where he was sort of living and working at the time. Colin Stokes is a former colleague of mine who's done a lot of stuff in his career, but one of those things has been a very well-respected youth worker in Sydney. He's been awarded Youth Worker of the Year at least once, managed services like the Fact Tree and Glebe Youth Service. So Colin came on board to sort of multitask as a artist and experienced youth worker to help Dave and I take the ideas and the sort of the core concept we had and turn them into the beginning of a visual story. So he sketched out the comics for us and helped us kind of turn our ideas into something visual. And then Ani O'Leary, who's the fabulous artist who sort of took those sketches, those roughs, and created the complete artwork that we're really proud to be presenting and using. That's really full of character and empathy and expression, and we're just sort of really proud of. So going a little bit off script there, but I wanted to acknowledge those three who've been part of this project. Really quick, what we're going to run through today, I've already given us our introduction and acknowledgement of country. I'm going to just for a couple of minutes touch on Sexual Health 101, just for, again, as we don't know who sort of might be picking up this resource, so we want to frame it a little bit. And Mika is going to follow up on that a little bit and sort of highlight the relevance and the specific challenges that culturally linguistically diverse young people experience when it comes to navigating health systems and especially sexual health. I'm going to take us through a quick look of the 4 comics that we've created and sort of some of their key messages. We're going to cut to a little video, which is just of Maker and I, so the same cast of folks, but we're doing a little role play. So we wanted to record that ahead of time to make sure we weren't too suffering from too much stage fright. So we'll check that out, look at that, a potential application of these resources and how they could be used, have a bit of a discussion about that. And then if we've got time, maybe even look at some of the other comments in terms of like practicing a little bit. Finally, Mika will just run us through some next steps for the project in terms of us piloting it and getting some feedback from folks that are either with us today or keen to join shortly. Let's keep going. I'm already tiring of the sound of my own voice, but there's nothing for it. No way out but through. Sexual Health 101. Basically, why is it important? What's the role of a youth worker, etc. Or person that works with young people but isn't in the clinician. What's their role in that sexual health space? We always kind of come back to this World Health Organization definition of sexual health. It's a state of physical, emotional, mental, and social well-being in relation to sexuality, not just the absence of disease, dysfunction, or infirmity. It requires a positive, respectful approach to sexuality and sexual relationships, and is inclusive of the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. So we include that in sort of, workshops and sessions like this always as a benchmark and sort of an aspirational goal, what we're working towards, and also to highlight, which won't be shocking to anybody, I'm sure, but to highlight the holistic and intersectional sort of nature of all things to do with sexual health and sexual well-being and reproductive health and well-being. That's just part of our holistic well-being. So really that's to underline the idea that if we're working with young people and we're concerned with young people's well-being in any capacity, then we have to at least consider and be aware of sexual health as a component of that. So just setting the scenes, I've got a few slides that include just a little bit of data about young people and sexual health in Australia. This is from 2022, so doubtless some of this data has changed a little bit. On the left, we have mean age of first sexual experiences, so it's sort of like bisexual experience. The mean age, for example, for oral sex is 15.4 years, 15.6 for vaginal sex, and 15.8 for anal sex. Probably more useful, helping us to sort of set a scene and wrap a head around it. On the right, young people who have had sex by year level. This study defines sex as that was inclusive of oral sex, vaginal sex, and anal sex, I believe. Apologies if I've misremembered that. We can see that year 9, 27.2% of young people have had sex, and by year 12, 58.2%. Obviously, this study sort of talked to like a very wide generalized sample of young people across Australia, although this data is specific to Victoria. So it's not specific to young people who may be experiencing particular hardships or culturally linguistically diverse young people, for example. Obviously, if we were able to focus on those groups, some of these stats would change a bit. It's just a bit of a snapshot. 27% or 27.3% of all young people who had sex had experienced rather unwanted sex, and that incidence gets a lot higher when we're inclusive of trans and gender diverse young people, LGBTQ young people, and women. By far the most common reason for unwanted sex was being pressured by the partner. My partner thought I should. Notable exception there is that 72.7% of trans and gender diverse young people said they were frightened as the reason for unwanted sex. So that's worth noting. And again, this is just setting the scene data. It's not stuff that's very specifically informed the production or the inception, the design of the comics that we're going to look at in a second. Just sort of setting the scene and highlighting the importance of talking and supporting young people around sexual health. In the middle there, drunk or high during last sexual encounter, 14.7%. Going off script a little bit, that's 2022. I think we can probably safely presume that number's gone down if we extrapolate other sort of trends about young people's drug and alcohol use. Probably gone down since 2022, and indeed has certainly gone down a lot since if you were to look at the data from, for example, when I was a young person in the late 90s. That's at least one good news story that sort of, for the general population, that particular stat is sort of going down. How often are condoms used? That one hasn't really changed and has actually gotten a little bit worse over the decades. So, 39.2% say always. That's not bad, but 11.6% say never. And 23 often to 11% sometimes. So that's in terms of health promotion and simple health promotion messaging, it's going to be an evergreen issue and an evergreen health promotion point that we'll talk to more later today. Encouraging young people to use condoms and destigmatizing condom use is always going to be a priority for us. Just finishing up, the proportion of young people, what sources young people go to for sexual health information. Far and away, the biggest one is female friends, followed by male friends, the internet, and mums. GPs, fathers, and school staff come in at less than 3%. Youth workers and other sort of allied associated professions didn't even get a mention. That's not to say that we're not important. There's certainly less contemporary data in Australia, contemporary research around the role of youth workers, if we define youth worker very broadly. There's a lot less information about the role that youth workers play for young people. But what we do have is pretty suggestive that for young people, especially young people experiencing difficulty, young people experiencing barriers around healthcare systems, that people like youth workers are really specifically important when it comes to sexual health, both in modeling positive behaviors and assisting young people to have correct information and sort of like overcome some of those boundaries and barriers. That's that quick sexual health 101. I'm going to pass it over to Mika to get a little bit deeper, talking about culturally, linguistically diverse young people and sexual health.
Cool. Thanks, Ben. If you just keep clicking through the dot points that come up on this slide, I'll just continue on from where you left off. Thank you. So we know that culturally and linguistically diverse and migrant or refugee young people may be excluded from traditional or mainstream relationship and sexuality education or RSE, or they're actively denied access to information about sexual health. And for many, if not all, young people, cultural taboos and stigma and shame mean that they really struggle to navigate their own sexual and reproductive health rights. Young people are really strong and capable and amazing, but they face additional systemic barriers. So sexual and reproductive health promotion is really important, as Ben, of course, was emphasizing. And it's always important that it is culturally safe, acknowledging and respecting those faith-based beliefs and taboos. Ben, I'll just get you to click maybe a couple more times. That's fine. So sexual health promotion is really important, but we need to make sure that we're always using appropriate language and approaches that are sensitive to the values of diverse communities, and facilitating open and non-judgmental conversation about these topics that most of the time people are really curious about. Would you like me to talk to this? Or do you want to just click on to the next point too? So interventions involving things like comics and cartoons and animations have emerged as really effective tools because they're engaging and they're accessible. Young people often like using them. Next section. And again. So we've worked together, as Ben outlined earlier, to develop 4 comics that we're really hoping will be useful for youth workers and other people working with young people in regional and rural Victoria to help as aids in conversations with culturally and linguistically diverse young people, especially in talking about topics like sex and sexuality and relationships. As you'll soon see, the comics feature landmarks from around us in regional Victoria. Hopefully you can spot some of them. And of course, as Ben mentioned, we've had some really great people on board with developing these comics, these resources, and we're really proud of them. We hope that they're useful to our friends in the field. Again, Ben's touched on this, but the comics don't include any prescribed text. There are pieces of sample text in the facilitator guides, but we want to allow people the opportunity to explore different topics and different scenarios with the young people that they're working with and have big discussions about what the characters might be feeling and saying and doing in each of the comics as well. And of course, there's the facilitator guide that accompanies the comic resources. And that's got some really handy stuff in it, like key messages about sexual health, some sample scripts if you need some prompts for the young people that you're working with, and some referral links too.
Thanks, Mika. And thanks for your patience with us, folks watching. Mika and I have had to pull this together a little bit of short notice, so sorry, Mika, for the confusion there. That was entirely my fault. Following on from that, let's just sort of get stuck in and have a bit of a look at the 4 comics really briefly. This is the first one, and we're going to look more closely at this in a second, so I won't spend too long on this one. This one's called Making Sure. For each of them, they've got some between 2 and 5, I think, key messages that we hope that the comics allow workers the opportunity to talk about. This one's about the importance of condoms, just raising awareness around sexually transmitted infections, how important and easy, hopefully, and confidential and simple STI testing is, and even an opportunity to talk about affirmative consent. Am I okay? Is a little bit more subtle. This one sort of features a young woman who appears to be concerned. She's in the bathroom and she's presumably sort of looking down at her body. So there's a whole range of things that she could be concerned about, and possibly gives us the opportunity to let a young person sort of steer that conversation, steer that interpretation, possibly towards sort of stuff that they're more concerned about. In the next frame, we see that she's wearing a hijab. So she's got these concerns. She goes to the library. That's Wangaratta Library, right there. She Googles up clinics nearby and pops in and has what we can tell by the facial expressions in that 4th frame is a friendly, pleasant interaction with the receptionist, and grabs some reading material, grabs some pamphlets. She later reads those and then calls to make an appointment. She gets to her appointment, and the doctor that she's seeing is wearing a hijab like her. So she's presumably quite comfortable and safe talking about those personal subjects, those personal concerns that she has. So key messages there is it's okay to talk to a doctor about private issues, and also an opportunity to talk about Medicare cards. What do I do? I think this one's my personal favorite. The key messages it's looking to sort of explore is the idea that image-based abuse is never okay, and also just exploring what constitutes image-based abuse. Also that image-based abuse is a crime, and always just, coming back to that point, it's always illegal to share an intimate photo or video of someone under 18. Another key message that's not exactly spelled out there in this one is just sort of highlighting the resource that is the eSafety Commissioner, website that young people can use to report image-based abuse and hopefully have images removed if they've been shared without consent. And then finally, of the four, we have a country challenge. We have two friends, presumably friends, walking along, and one of their phones rings, and she sees that she's got a text from boyfriend, letting her know that a condom is broken. She's looking pretty upset right after that, but her friend is staying calm, and gives us what looks to be some positive advice. She pulls out her phone and searches for nearby pharmacies. Next scene, they're in the pharmacy, and they're having what appears to be a positive interaction with the pharmacist. And in the final frame, she's grateful to her friend, and it looks like she's procured something that is obviously open to interpretation, but we can assume, or we could sort of lead the conversation towards being emergency contraception. Although it could easily be replaced with a pregnancy test, or for example. So key messages there is that pharmacies can provide emergency contraception, as well as condoms, lubes, and other stuff. Emergency contraception is a totally safe and effective way to prevent pregnancy. And if we want to go deeper, we can talk about it being more effective if taken within 72 hours. An opportunity to talk about sexually transmitted infections, and that condoms are the most effective way to prevent them. And also just talking about there's no shame in seeking sexual health care. We can see that, at least in this case, hopefully it's not too idealized, that this very pleasant pharmacist is non-judgmental and is helpful, which we know is not always the case. But with that in mind, the facilitator guide for this comics highlights the importance of the service 1-800 My Options, which young people can use to find pharmacies that happily provide emergency contraception. I'll just take a break or take a moment to breathe there. Bridie, you're our sort of like our token participant here, which we're really grateful of. So I certainly don't expect you to have any input or questions necessarily. But at this point, is there anything that you're wondering about? We're sort of galloping along, and it might be nice to just give you a second to ask any questions.
I am just loving it so far. I think it's really clever that there is room for like there's no text, like you can add text to like you can sort of frame the conversations around that and put that in that's relevant to who you might be talking to about it. I think it's a really cool creative way to work with refugee and migrant background young people, particularly because it's sort of, yeah, it's a really helpful, it's really challenging to have those conversations without something that you feel can make it more individualized to have those tricky conversations. It's really cool.
I'll use that. I mean, thank you. That's really excellent to hear at this point, obviously. Got goosebumps. That's great. I'll use that as a jumping off point to talk a little bit more about that idea, just because it's a good opportunity, and then into our next segment. We sort of envisage these being used in two capacities. One very much kind of like what you just, well, actually, I'll come back to that in a second. The first one is it could be totally used quite effectively in a classroom setting as a group activity where you divide your classroom, your group into 4, and you give each group one of these comics and say, sit down, talk about it together, fill it in, and let us know what you think the message of it is. Lets young people lead each other and show off what they do know. It makes it a less sort of didactic learning experience, and then gives a pretty easy way for a facilitator or a teacher to jump in and add any important key messages that any young people might have missed there. The other one is in sort of more of a one-on-one setting, whether that's casework or like a clinical counselling setting, for example. The thinking being, and we can't really take credit for this idea, we're not the first people to do it, but that sort of like you were saying, by talking about the characters rather than talking about the young person that you're working with, you're freeing them up, making them feel possibly less under the microscope, and more hopefully willing to engage with the issues and give you just a little bit of leeway to get in some of those important health promotion messages. With that in mind, let's check out this video that Mika and I have recorded of exactly that. I'm going to have to, as soon as I press play, mute my speaker because I won't be able to cope watching my own video. That would be too brutal. But hopefully this is illuminating, and we'll have a little chat about it afterwards. Let me know. Just give me a thumbs up if you can hear.
Cool. Hey, Mika, how you going?
Yeah, all right. How are you?
Yeah, not bad. Thanks for asking. So let's get stuck into it. Remember a couple of weeks ago we did a thing called the heads assessment, where basically I just asked you a bunch of questions.
Yeah.
Do you remember that some of those questions were about sexual health?
Yes.
Yep, sure. So I thought it might be a good idea to talk a bit more about sexual health, come back to some of those issues and questions. How do you feel about that?
Yeah, it's like awkward, but yeah.
Sure, fair enough. Look, I don't, it doesn't have to be, but I understand if it is for you, that's okay. It is for lots of people. How about this? Rather than me asking you any personal questions about yourself, I've got this comic, which don't just bear with me. I've got this comic here. We can check it out. It's got all blank words. So the idea is we could have a look at it, try and figure out what's happening to the characters, and talk about what they're going through, and fill in the story and fill in the words, and then just have a talk about that rather than me asking you any questions about yourself. How does that sound?
Yeah, okay, I'll do that.
Okay, cool. Look, let's give it a go. And if you've got any questions or anything at any point, just let me know. So, check it out. This one's called Making Sure. So, let's dive in. Like I said, it's got no words. We've got to sort of figure out what's happening in each scene and fill in the words. So what do you think's happening in this scene?
Uh, I guess they're like a couple and I don't know, they're in love and they're making out and hooking up or something.
Sure. Yeah, totally. What do you think? Any ideas about what they might be saying?
That they love each other.
Sure, maybe. Yeah, totally. That could totally be um, something they're saying. I was thinking, I noticed that on that night on the coffee table there, or the bedside table, there's some condoms, but nobody's reaching for them. So maybe they're saying, we don't need to use a condom. Is that something, would that sort of fit maybe?
Yeah.
Sure. Okay. But we could probably go a bit deeper. What's a reason they might be saying that? Like,
I don't know, like maybe she's on the pill.
oh yeah, so maybe like she's saying, I'm on the pill, so we don't need to use a condom. Okay, yeah, cool. Or, it could even be the other way. It could be he's saying, you're on the pill, so that we don't need to use a condom. That's interesting. We'll come back to that. Let's go with that one. Is that okay?
Yeah.
All right, cool. We'll come back to that idea. I just remember that point because I want to come back to that. Okay, so next frame, next day at school, what's happening? What do you see?
Or they're doing like sex ed or something.
That's right. Yep. What do you notice? Like, how do they look? Do they look like they're having a good time?
No, they look scared.
Why do you think they're scared?
Or maybe because they didn't use a condom or something.
Yeah, I think you might be right. It says up there, like if you notice the teacher's got a bit of paper, risks include pregnancy and sexually transmitted infection, which is a risk of not using a condom. The pill protects you against getting pregnant, but it doesn't actually protect you against STIs, which is an important thing, and lots of people don't know that. Okay, cool. So next frame, what do you think's happening here?
Or they're like fighting, yelling at each other, angry.
Looks like it. Yeah, I would agree with that. What do you think? What do you think they're saying?
Um, like they're scared or they're angry that they didn't use a condom when they had
Yep.
sex.
Maybe one of them is saying, depending on who said we don't need to use the condom, maybe the other one's saying something like, "You said we didn't need a condom, and but have you had an STI test?" Because there's no way to really know if someone has an STI if they unless except having a test, right?
Mm,
And then maybe the other one is saying, "I thought it was safe."
mm.
Yeah, is that okay?
Yeah,
Cool.
yeah.
Alrighty. Yeah, and that's, that's a fair thing to be upset about. Like that, I can imagine that being a bit of a fight. So let's see the next frame. What's happening here?
Oh, they're like talking to their friends. They're sad and I don't know, maybe their friends are helping them or something.
Totally, yeah. What do you think the girls up top are saying?
Maybe like I'm really worried that I've got one of those STIs.
Sure. Yeah. I'm really worried what if I caught something? Sure. Down the bottom, it looks like, I don't know, it kind of looks like his friend's giving him some advice. Maybe his friend is saying something like, because we talked about STI testing a second ago. Maybe his friend is saying like, it's not that big of a deal. Just get a test and then you'll know. Happy
Yeah,
with that?
yeah,
Okay,
okay.
cool. All right. Well, next frame in the story, what's happening now?
Um, they're at the clinic.
Looks like they've gone separately to go, and it says there he's at the sexual reproductive health clinic. Cool. What do you reckon that friendly bald doctor is saying?
Um, like you're all good, don't worry.
Sure. Or even I've just got come on in. But yeah, totally. It depends whether he's coming or going, I guess, totally. Yeah, and down the bottom, what do you think maybe that the girl is saying to her friend?
Um, don't worry, like I'll help you.
Sure. And what do you think maybe she's saying back to her friend that brought her there?
I'm worried or thanks for helping or something.
Yeah, let's put that. Thanks for coming. You're a good friend. Cool. Okay, great. Last one. How do they look?
Yeah, good, fine. They're happy
Yeah,
now.
like they've made up.
Yeah,
Yeah, what do you think maybe what's she saying?
maybe like it's all good now. Sorry, I was angry.
Sure, yeah, fair enough. Sorry I was angry with you. But maybe, I mean, if she says that, I hope he would say something like, um, you were right though. Sorry I took that risk. Let's be safe from now on. That's a nice ending. It's a bit cheesy though, isn't it? What about maybe no condom feels good, but honestly being safe feels even better.
Yeah, yeah, that's right, I guess. You don't
Cool.
want one of
Okay.
them STIs.
Totally. Just before we finish up, I won't ask you to do any more awkward comic stuff, but what do you think the person that wrote this comic, what do you think the message they were trying to get across is?
Um, like safe sex stuff, like to use condoms and like if someone tells you not to use a condom, you should say something back to them, like encourage them to use it.
Yeah, totally. And I think they would want us to remember the mistake, maybe, the mistake that these guys made the way we filled it out, where they said we don't need to use a condom because you're on the pill. I think that probably they want us to remember that that's not true. The pill only protects you from pregnancy, not STIs. Maybe one more message, something about STI testing.
Yeah. Yeah, like so you can just go to the clinic to get one of them.
Yeah, it's totally anonymous. It's free, and it's just like it's better to know, right?
Mm.
They
Yeah.
actually say the recommendation is that you should get tested every time you change partners or every 12 months, even if you haven't changed partners while you're a young person at least.
Yeah. So I
Cool.
can just like call the clinic and book in. Anyone can.
Yeah, you can call and book in at like any GP. But if you know the clinic, if you know a sexual health clinic, you can also just rock up on days. If you give them a call, sorry, and see when they've got open hours, you can just rock up with no appointment sometimes. But it's also you can make an appointment if you want.
Yeah. Yeah. Cool. Good.
Cool. Okay. Anyway, enough of that.
Well, that was difficult for me to watch entirely because of my acting. I was pretty impressed, frankly, with Mika. I had the benefit of writing filling it in beforehand. Mika only got one short run through of that, so her acting was pretty much entirely off the cuff there. So I think that was pretty impressive. So thanks, Mika. And hopefully that was somewhat illuminating and showed some sort of the potentials for communicating key messages and starting conversation that the tool could provide, even if it is in a slightly idealized or stilted sort of way. That's the nature of role plays. We've got time for a bit of discussion if we want. We've kind of got the slides set up so that we could go through each of those frames again and add anything extra if we want, or ask any questions or sort of discuss other learning points that we could have gone into. We won't spend too long on that, but there's a few other interesting points that I think are worth touching on. For me, and I want to, Bridie, feel free to add any input or questions, and Mika, of course. For me, for this one, I think something that we've included in the facilitator notes, a great opportunity here is possibly you might want to take this an opportunity to talk either about affirmative consent and sort of talking about what affirmative consent is. You could also talk about, and we debated whether to sort of go this direction with our facilitator notes and key messages, and we didn't in the end, but you could definitely also use this to sort of go this frame and the rest of this comment to talk more about sort of partners, not necessarily with a gender perspective, possibly with a gender perspective, pressuring one another not to use contraception. The version that we sort of role played out was fairly seamless, and I don't imagine you'd want to, in a conversation with a young person where you're filling this in, like get too into the weeds or too deep into the role play. But that is another sort of potential direction this could go, whether that's where the young person takes it or where the sort of possibly the message you might want to get across to a particular young person if you have concerns around that. With a particular young person in mind. Mika or Bridie, anything else you sort of want to add looking at this frame?
Just want to touch on as well, like obviously, as we all know, initiating conversations with clients or with young people or with anyone about sexual health, relationships, sexuality is often quite challenging. But some of the best evidence that we have for sexual health promotion is around incorporating pleasure and sex positive approaches. So at any opportunity you can, really framing it as a positive thing. We talk a lot about, or traditional RSE talks a lot about the harms of sex, unwanted pregnancy, STIs, but a really important way of contributing to reducing the harm of those things is by talking about sex in a positive way. So any opportunity you can to frame the positive, romantic, intimate sides of sexual health and relationships, please go for it. Please do, because it works.
That's really great. Thanks, Mika, for mentioning that. That's a really important thing to consider. I don't think there's any other direction I would sort of like want to take this frame. It's pretty straightforward. They're alarmed. There's a nice little detail there. The risks include the teachers holding a little handout. I just think the art in this one is fabulous. It's worth noting. The teacher is just such a cool character. And this dude in the front who's looking kind of bored. I just think they're really excellent. So it's a bit of an aside.
Also, on that one, I think like probing if you're working in a one-on-one setting, the person on whether they've had relationship and sexuality education in school or if they've got other people that they can talk to safely about that. Because we know that experiences of RSE range a lot. So just checking in, what do you know about sex? What have they spoken taught you about sex and sexual health at school, so you can value add there or contribute.
It's a really great insight. Thank you, Mika. On this one, not so much a different direction you'd want to take it, just a note. We deliberately wanted this one designed to not have it feel like one character is more angry at the other, so that's open to interpretation. Obviously, there is a gendered there's a pretty clear gendered element to any discussion around consent and safe sex and the consequences of unsafe sex for people with female bodies versus male bodies. So that's very real, but we didn't want to sort of railroad that in the design here. So it can sort of the discomfort, the anger, the frustration can go either way, both ways, or it can be something entirely different based on interpretation. Mika, anything you want to add there? And the rest are fairly straightforward. This one's a nice opportunity to steer the conversation, include some sort of positive role modeling. Look at these good friends looking after each other, and hopefully encouraging the characters to go get tested because it's safe, quick, easy, and often free and private.
And really lead on those opportunities to divert the conversation around asking specific questions, maybe asking the young person that you're working with questions like, if you were the friend, what would you do? Because that avoids that intimidation of it being a question about you and your sexual health.
And finally, just our nice cheesy happy ending. We didn't want to overcomplicate it, and it can get as preachy and as meaningful or as lighthearted as need be there. Just a little call out, that scene is that bridge we can see there where this one's set in Mildura. That's based on a real photo from Mildura, which we just thought was a nice touch. So on our agenda, we had a bit of a group work, trying the comics out for ourselves session, but I think given that there's so few of us and we've actually already in danger of running long, we might skip that. And I'm going to go straight to, if you let me change between documents, having a look at our facilitator guide, because as much as the artwork is incredible, and it is incredible, an equal amount, actually possibly more work, has gone into the facilitator guide that goes alongside these resources and helps folks be able to pick them up and use them, hopefully without really any particular guidance. So this will be available to download, or we'll email it out to folks who are helping us pilot the comics. This will come with the comics. Ultimately, all the comics in this facilitator guide, along with this video, will sit on the CERSH website for anybody that wants to use them. So we've got an introduction that goes through stuff we've talked about here today, the importance of talking to young people about sexual health, the role that youth workers play, and the idea behind the comics, as well as a little explanation of what we've talked about, the one-on-one application versus group or classroom. Then the real nitty-gritty of it, for each of the 4 comics, we've got our highlighted key messages. We've got a brief, fairly open explanation of the story, in case as a facilitator you sort of pick it up and you're like, I'm not really sure actually what that means. And then facilitator notes. So that's just going into a little bit of what's the issue that this particular comic is exploring, and what's going a bit deeper into the role that a youth worker, for example, might play in supporting young people around that particular issue. So, and then again, for each one, we've gone to the extent of providing frame by frame prompts and questions. Prompt questions and sample text. So if you're really drawing a blank, you can even, or if the young person you're working with is drawing a blank, there's even something to get conversation started or draw from. Not to say that the sample text or the prompt questions that we provided are the only ways that the comics could be used. We just wanted to give folks something to work with and something to get started. So probably more important to my mind than the sample text is the prompt questions, helping you sort of have somewhere to get started when encouraging a young person to contribute or offer any insight. As I say, we've provided one of these double pages for each of the 4 comics, so they go fairly in depth. It was quite a task, but we're really proud of the facilitator guide alongside the comics. And then it finishes up with some expanded key messages. So the same key messages that are attached to each of the comics, just for some of them, we wanted to provide a little bit more information. So that can also function as its own sort of standalone fact sheet that you might want to keep on hand or provide to workers, just to highlight some important key messages for passing on to young people around sexual reproductive health. Anything you want to add there, Mika, about that?
That's great. I'll cover it in next steps.
Excellent. So give me 1 second and I'll get back to the slide deck. Thanks for your patience, everybody. And I'll go full screen. Great. So Mika, over to you.
Cool. So we're going to set you free pretty much now. Please use the comics and the facilitator guides. I'll send you an email after this with links to the PDFs. If you need support with printing, laminating, please reach out to us as well. That's absolutely something that we would like to support with. And while you're using them, just think really critically about how they could be better. It's in a pilot phase at the moment, and if there are any changes that we can make to this resource to make it better, that's what we want to do. So in 6 to 8 weeks from now, I'll send you another email and I'll give you a call. Maybe we can set up a time to have a really quick chat about how they've been going. No more than like 15 minutes, just to get some evidence on how they've been used and what we can do to improve the usability of them. And then we want to make them publicly available on our website. So because they're in the pilot phase at the moment, we're not making them public right now. So if you do think of a colleague or someone who would like to use them, please, we would like to share them, but please loop us in as well so we can follow up and provide additional support or information while they're in their pilot phase as necessary. And then, of course, it will be free and publicly available on the CERSH website. If you do have any questions or feedback before I get in touch with you, give me a call, send me an email. I'm always available for a chat. But yeah, we're just really interested to know what you think of them, how they can be better, and then to make them available.
And I guess I'd just add there, like in terms of testing them out, really all we hope for is that folks can try. If you have them on hand and you approach the next 6 to 8 weeks with the idea that if it comes up, if it seems like it's if it seems like the thing to do, I'll absolutely try and use this resource. And at the end of that period, they're never appropriate, they never work, they never sort of fit into your practice, then that's great feedback too. It's all we really want is for folks to be open to trying them and have them on hand and be familiar with them and willing to give it a go. We can definitely hang around and chat and answer any questions, but maybe we'll finish the recording there. So for folks watching this later, thanks very much for taking the time. I hope you have a great time using the comics.